Are you the parent or someone who needs to get their wisdom teeth removed, but you still have a lot of questions and concerns? It's very common to still be a little bit scared. So in order for you to understand better, I'm going to interview Dr. Jason Portnoff, who's an oral maxillofacial surgeon that performs these procedures day in and day out. He actually did my daughter's wisdom teeth last year, and everything went great. So make sure to stay to the end because there is a new procedure that he's incorporating, and it's called PRF. He'll discuss it later. Hey, I'm Dr. Capra, and I'm a board-certified pediatric dentist and mom, and I'm here today with Dr. Portnoff, and we're gonna get started with the most common questions that you have regarding your wisdom teeth. Okay, all right, so we're here. It's been a while.
It has.
My phone's ringing, hold on. My kids.
Right.
Okay, so let's start with the simplest question. What is an oral surgeon? What is it that you do?
Sure, so oral surgery is a branch of dentistry. It's after you finish dental school, you do additional training in a hospital setting. The training is between 4 and 6 years usually, and then you can do fellowships afterwards. Personally, I did my training at New York Presbyterian Cornell, and I did an extra year of training in pediatric maxillofacial surgery in Australia.
And this might seem like a very basic question, but what is a wisdom tooth or a third molar?
Yeah, so wisdom teeth are your third molars. So you have, 4 of them usually. Sometimes you have less, sometimes you have more. So that's why we need the x-rays to see what's brewing underneath the gums. And basically, they are the teeth that come out at about age 16, 17, or 18. That's why they're called the wisdom teeth, because you're older, right?
Yeah, you're supposed to have some wisdom.
You're supposed to have some wisdom. And we joke that, when we're taking the teeth out, we leave the wisdom, but we take the teeth, basically. Yeah. So, but, they come in at weird angles usually because, these days our diet is different. The thought was that as you were getting older, in primitive days, your front teeth would get worn down and all the teeth would shift forward, and then the wisdom teeth would come out so you could, chew on those.
Chew on those food.
Right.
Ah.
But now our diet is different, and, wisdom teeth just come in with no room, and, everything else is nice and straight.
We don't need to work as hard to chew our food.
Exactly.
Okay. So I think that the most common question that I get is, what is the best age to remove wisdom teeth?
Sure. So when we get a patient in for a consult, we usually want to ask them if they're in any pain, if the teeth are causing them any trouble. A lot of patients these days have been through orthodontic treatment, and the orthodontists are usually concerned that the erupting third molar teeth are going to damage the back of the second molars, or even cause crowding later on.
Is that true? Do they cause that crowding?
I think that the crowding can happen regardless.
Yeah.
The most important thing is that people wear their retainers, right? So.
Yeah.
If you go through all the experience and the work of getting your teeth straightened, it's really important to wear the retainers, and the teeth can get crowded regardless. If you don't wear your retainers.
Yeah. So wear your retainers.
Wear your retainers. When we get the patient in, we usually take an X-ray. It could either be a Panorex X-ray or a cone beam CT scan, which is basically looking at the teeth in 3 dimensions, and we want to see the root development and where the teeth are in relationship to other structures like the nerve on the lower jaw or the sinuses.
Okay, great. So not everybody has an exact age to remove the wisdom teeth. It just really depends on the development of the person.
Yeah, some teeth don't even need to be extracted.
Yes.
And you don't want to just take them out without any reason. So we want to go through a full evaluation to make sure that the teeth really need to come out.
Yeah. So when they do need to be extracted, what are the reasons? What are symptoms and signs that people should look out for?
Well, pain and discomfort is always something to be a red flag. And then sometimes on X-ray we'll see maybe cyst development, or the tooth is in a bad position and it could cause damage to other teeth. Some teeth that you could just tell are going to be a problem later on, causing discomfort, or they're erupting in a weird angle or something like that.
Yeah.
So.
And it's easier to remove wisdom teeth when
so when
you're
they're young.
Easier, right? Yeah.
I get a lot of patients in their 40s, my teeth are bothering me, and now the roots are really long, they're wrapped around the nerve, it becomes a lot more tricky to get the teeth out at that time.
So definitely younger is better. What are signs of an infected wisdom tooth?
Okay, pain is always a sure sign. Fever, swelling. Sometimes you can taste pus or even see pus coming around, the back of the second molar, around where the wisdom tooth is. And usually that would be a red flag to immediately, go see your dental provider or your oral surgeon to make sure that, something has got to be treated and we can do something about it.
Okay, so this question I get asked by patients, 15, 16-year-olds. They're afraid to do all 4 wisdom teeth at the same time, and I tell them it's so much better, just do all 4. They want to do 2 and 2. What's your take on that? What do you think when they need all of them removed?
Right.
What do you think?
I find that most people just want to do it one time,
Yeah.
just get it over with,
Yeah.
So, the patients will come and they'll say, what's my downtime? And usually, it's a couple days of discomfort, and then, they feel much better. So either do it once or twice or 4 times, depending on, how many times you come back to get it done.
Yeah.
So now, especially, we have something we're using here called Exparel, which is a long-acting local anesthetic that lasts 3 days.
Yes.
So we can keep patients comfortable and numb basically for 3 days post-op. Peak of swelling and discomfort is usually 2 days. So you're numb beyond that period of time. The most important thing about that is we're reducing the amount of narcotics that we're prescribing
Yes.
for patients.
And you use it on my daughters, which was great. The
Yeah.
recovery was awesome.
Yeah, perfect.
Yeah.
So,
Yeah.
when we see as
They didn't even need narcotics.
that's the
They
best
didn't need
part.
it,
Yeah.
yeah.
So wisdom teeth is sometimes the very first surgery that a young person would have. 16, 17, 8 years old. So if you're having your first exposure to narcotics at that age, it's not a great thing. So we're trying to avoid that, and whatever we can do to limit
To
the amount
minimize.
of exactly.
What are the types of sedation during the surgery, and how to manage pain after they have their surgery?
Yeah, so most of the time we like to see a patient for a consultation appointment first. That gets the patient and the family kind of comfortable with the office, comfortable with the surgeon, and we can, address their fears beforehand. So coming in with a consultation appointment, usually you're much more, level-headed by
At
the time,
ease,
at
yeah.
ease when you're coming
Yeah.
for the surgery. And so at the time of the surgery, we offer, different types of sedation. You can do nitrous oxide, which is laughing gas, which a patient is still aware but kind of doesn't care about what's going on, and that's easily titratable, so we can dial it up or down depending on the patient's comfort. We use local anesthetic so the patient's not feeling pain during the procedure, just the pinch of the needle. And even that, we try to use topical anesthetic first, so it's not as
As
uncomfortable.
bad,
Yeah. And then there's also IV sedation. So with IV sedation, we start with the nitrous oxide, then we start a little IV in the arm where we give the medications to put the patient to sleep. And basically, the patient goes to sleep, wakes up, the procedure's over, and we call it, there's different levels of sedation, but we call it like a twilight sleep. And basically, parents have to drive the patient home. They can't drive themselves, and they have to be fasted for 8 hours before. You don't have to be fasted necessarily for nitrous oxide. You could have like a light meal beforehand. And then for post-operative pain, the best pain remedy is basically Motrin, 800 milligrams or 600 milligrams, depending on the patient's size, alternating with Tylenol extra strength. That actually has been shown to be more beneficial for dental-related pain and inflammation than narcotic pain medication.
Yeah.
So if a patient post-operatively takes Motrin, every 8 hours or 6 hours, and Tylenol extra strength every 4 hours, you always have something that you could take, and usually they're comfortable post-operatively.
Something else that I wanted to share, Dr. Portnoff is very innovative, cutting edge, and I was very, very happy with the way that my daughter's wisdom teeth removal went, from start to finish. And he was telling me about a new procedure called PRF.
Yes.
That's what we were talking about at the beginning of the video. We're going to talk about it now.
Yeah, so PRF is platelet-rich fibrin, and basically what we do is when we start the IV, or if a patient's not getting IV, we just draw a little blood. But we draw blood and we spin it in a centrifuge, and we basically separate platelet-rich plasma versus platelet-poor plasma. And the PRF is platelet-rich fibrin. It's got all the growth factors that help with healing. So we get a little clot, and we can put that into the surgical site after the tooth is removed. It helps with soft tissue healing, and we find it reduces the amount of dry socket.
Dry socket, that's another topic that we needed to talk about.
Yeah, so dry
How
socket.
How common is it?
It's not that common. It's maybe about 6% of the time in oral surgery practices around the country. But I do find that our numbers of dry sockets have been reduced with the use of the platelet-rich fibrin. So basically what a dry socket is you're trying to get a clot to form where the tooth was removed, and if a clot doesn't form there or the clot gets dislodged, you have basically the bone is exposed and nerve endings are exposed, and it becomes very painful.
Yeah. And how would a patient know if they have dry socket? Just pain?
Yeah. So
go back and see?
Basically, if you start to get better post-operatively, then all of a sudden you start to get worse, and it starts to feel very uncomfortable between days 3, 5, 6, 7, or something like that. You might have a dry socket, and we really want to see you, post-operatively to evaluate you.
Okay. Are there any other questions that I didn't ask regarding wisdom teeth that you get asked all the time? Those are the ones that I get asked, but what about you?
Overall, no. I mean, I think we touched everything. People are always concerned about, whether or not they need to be asleep. whether or not they can do nitrous, if they can drive afterwards, whether or not they need their wisdom teeth out at all. And really, it's an individual assessment. Each patient is different. Some people don't need their wisdom teeth out. Some people don't need to be asleep. Everybody's different, and really we have to evaluate you, to figure out what's the best thing for you.
If you have any other questions or comments that we didn't talk about in the video today, feel free to leave them down below and we'll definitely get back to those and address them. Thank you so much for your time. And I want to tell everybody, if you're in the South Florida area and you need to get your wisdom teeth removed, come on by. We'll leave the information for Surgical Arts of Boca Raton.
Thank you. Good to see you guys. Awesome.